The Brazilian butt lift is commonly referred to as the BBL. This is a procedure that's designed to enhance the buttocks. It's a surgical procedure that involves liposuction and fat transfer. So what that means is liposuction is performed in problematic areas. Typically these areas involve the abdomen, the waistline, the flanks, the back rolls, maybe some fly rolls, any areas which have fat that can be used to harvest and ultimately transfer to the areas of the buttocks, any areas of the buttocks that need enhancement. When we talk about enhancing the buttocks, some people are looking for volume, some people are looking to restore shape, and some people are looking simply to accentuate the waistline. Thin waistline and a nice transition to a fuller buttocks is characteristic of a typical feminine Coke bottle appearance. So fat is harvested from these problem areas, and they might not be so problematic. However, there are areas that are better for removing fat and using fat to be able to transfer into the buttocks. Once the fat is harvested from these areas through liposuction, the fat is removed. It's prepared in such a way to be ready to inject into the buttocks. It's very important to keep in mind that if we remove, let's say for example, 2 liters of fat from those areas that we discussed, those 2 liters, when we inject them, aren't all going to survive. There's a certain percentage of fat that's actually resorbed, meaning it doesn't take, it almost disintegrates. And there are different percentages that are reported by different studies, but what we try to do is overfill in certain areas. The reason why we overfill is that we expect anywhere from 25 to 30% of that fat that we've injected to dissolve. Now, the buttocks has an excellent blood supply because of the gluteal muscles. And that blood supply is what we're counting on to help the fat that we transfer take. So it's very important to understand that if you remove 1 liter of fat, that 1 liter of fat is not going to take, and it's not something that we can see instantly. So after that liter is injected, it takes at least 6 to 12 weeks before we're able to see exactly how much of that fat has been retained or integrated into the buttocks. Everyone is not a candidate for this procedure. Obviously, there are some people who come in and they request fat transfer to the buttocks, and they're 5'2", 100 pounds. It's very difficult to harvest fat and to actually make an appreciable difference on someone like that. Alternative therapies, we've all heard of some of the disasters related to non-FDA approved materials injected into the buttocks. Now, some of those have been silicone, some of those have been different products that haven't been approved in the United States, and we've all heard about the disasters associated with some materials like Fix-A-Flat. These are very, very dangerous alternatives and should not be entertained by anyone. And the important thing to focus in on the expectations of each individual. Injecting 1,000 cc's of fat in one person is not going to be the same as injecting 1,000 cc's of fat into the buttocks of another person. So these individual requirements, individual needs are tailored to meet individual expectations. But the most important thing to take home from this is the fact that safety should always be the #1 priority. So we want to know how we can achieve or exceed your expectations in the safest possible manner. So it's very important to have a consultation with your plastic surgeon to review your history thoroughly, to review your medications. In some cases, people have been trying to lose weight and they are taking over-the-counter diet pills or prescription diet pills because these medications do have a certain risk factor when patients are undergoing anesthesia. To learn more about this procedure and the other procedures that we perform here at Face+Body Cosmetic Surgery, I encourage you to go to our website. We have excellent 3D animation videos on the site that can offer you more insight into this procedure and others. Thank you very much.